Hi, I'm Jason Howland. Welcome to Speaking of Health, a place to help you learn how to live a longer and healthier life. September is National Prostate Cancer Awareness Month, and it's something everyone should be very aware of. It affects nearly 1 in every 6 men in the United States. Our guest today to talk about prostate health is Dr. Joe Lee. Dr. Lee is a urologist with Mayo Clinic Health System. Dr. Lee, thanks for joining us today.
Thank you. Happy to be here.
So you see patients with prostate cancer quite often. How common is prostate cancer?
It's a fairly common problem. It's the second most common cancer in men. 2.1 million men may be living with prostate cancer. There's almost 250,000 men discovered with prostate cancer in the year 2012. And there were 28,000 deaths from prostate cancer in the year 2012.
So Dr. Lee, let's start with the basics. What exactly is the prostate, and is it something that only men have?
So the prostate is a gland that's at the bottom of the bladder, and you urinate through it, but that's what causes most of the difficulties. The prostate is a walnut-sized gland, and it produces a lot of the seminal fluids in the ejaculate.
And is it something, obviously, then only men have, right?
And only men have it, yes. Thank you.
So what are some of the signs and symptoms of prostate cancer?
So most men, when they have prostate cancer found, now with screening tests, don't have much in terms of symptoms. But as the symptoms get worse, you can have frequency of urination, and you can have decreased urinary stream, blood in the urine or blood in the semen. And also, if it's spread past the prostate, for example, you may have bone pain. And so those are different things that you can have with prostate cancer.
And is it a cancer that grows slowly, or does it progress very rapidly?
So it's a mixture of the two. Most cancers are slow growing, but there's still a significant number that are fast growing and can affect people's lives.
So for most men, as you stated, prostate cancer is detected during preventive screenings. So what are those tests that are involved with the screenings?
So the screening is involving two different things. One is a prostate examination, and so that's a digital rectal examination, and also the PSA test is a blood test that has, since the late 80s, has really revolutionized the screening of prostate cancer. And the reason is that it can find prostate cancer 5 to 7 years ahead of time before people have symptoms or before you can find a nodule on the prostate.
And what does PSA stand for?
So PSA stands for prostate-specific antigen, and it's a glycoprotein that's secreted by the prostate that changes the character of the ejaculate from a thick liquid to a thin liquid, but it also is measurable in the blood, and that's why it's a valuable screening test.
And higher levels of that PSA indicate that there may be a prostate cancer growing?
And that's correct. So the prostate cancer, or the PSA, may be elevated, and it depends on the age of the patient, what is the normal. However, even when it's elevated, only a third of the patients may have prostate cancer. Other things that can cause elevation in the PSA is BPH, infections, scarring of the prostate. So it's very important to follow up on the PSA test if it's elevated, such as a biopsy, to determine if it's prostate cancer or not.
So at what age would you recommend that men come in to get that preventive screening done?
So the recommendations are continually changing, and so presently, as of May of 2013, the American Urological Association recommends PSAs starting at age 55 to age 70, and if you have an increased risk of prostate cancer, say in a brother or father or grandfather who have had prostate cancer when they were young, you may want to have your prostate PSA tested as early as 40 to 45, or if you're Afro-American, you may want to have it tested earlier also.
And so that age guideline has actually, it's gone up. It was a younger age before, right?
Right. And so the reason for that is that there are always complications, there's always risk to any procedure that you do, whether it be for cure of prostate cancer, for the biopsy, and you weigh that against the risk of the prostate cancer, how slow growing it is, how fast growing it is. So the recommendations have been adjusted a bit.
So how is the disease treated? Is it different than any other cancers?
So when you look at prostate cancer, for any cancer, you look at two different things. How fast a growing cancer is, and if it's spread outside of the original organ. So if it's a fast-growing prostate cancer, if it's looking like it has a chance to affect people's lives because it is a more rapid-growing prostate cancer, higher risk, then you may want to be more aggressive with it. So you can do surgery, you can treat it with radiation, you can watch it if it's a slow-growing cancer, and if it's spread to, say, the bones, you may help the symptoms with hormone treatments.
So, Dr. Lee, when it comes to treatment, how do you determine whether it's surgery or radiation or some of the other things that you talked about? How do you determine what type of treatment the patient has?
It's real key because every patient's an individual, and every individual, you have to customize their decision making. And so you have to look at the patient, you have to work with their primary care to see what their survival is. So if they're really old, has had 3 strokes, 2 heart attacks, and you have a slow-growing prostate cancer, we're not going to recommend radical prostate surgery. Probably won't recommend radiation therapy. But if you're young and you have a long-term survival, over 15 years, over 10 years, and the prostate cancer, when we look at the grade of the prostate cancer, your PSA, and determine your risk of dying from the prostate cancer if you don't do anything, those are called Albertson tables.
You talked about surgery. I know technology in the last 20 years is it's so much more advanced now, and you're even using robotics now with prostate cancer surgery, right?
Right. So traditionally we do make an incision, and then we reach in, do the surgery. But what people have found is that you really don't have to touch it. You can guide your surgeries with a camera and just place the instruments inside with incisions that allow a pen to go through. For example, when people have gallbladder surgery, nowadays most people will not have it by open surgery, but will have it with laparoscopes. It's right underneath the liver, so you can just use traditional laparoscopes and their instruments. But prostate cancer, if you imagine working on the bottom of an upside-down pyramid, the prostate is right at the bottom of that corner. And so what you use is a robot. It has the ability to see it in 3 dimensions because there are 2 cameras involved. You can use the instruments that are computer controlled, so your movements are finer, and with the magnification, it's like operating with a microscope.
And the benefits for patients when it comes to this type of surgery is?
So what we've found, and it's well documented, is that the estimated blood loss during robotic surgery is much less than open surgery. There's some hints that the erectile function is better preserved, as well as continence rates, and people recover and return to work much quicker. They require less pain medications because they have less pain. At present, we do remove the entire prostate, and then you have a gap between the bladder and the urethra. And what you do is you use the robot to sew that gap back together. You know, it's very easy to sew one end back to the other, but actually it has to be waterproof. So it has to heal a little bit longer. That's why you need a catheter in to drain the urine. And we do an x-ray at the end of about a week and remove the catheter at that time.
And removing the prostate, this isn't a gland that's necessary to live, correct? So it's okay if you remove it, sort of like your gallbladder, right?
Right. And so, you know, men over age 60, for example, may not want to have more children, and that's the main function of having a prostate because it creates most of the secretions that is in the ejaculate.
All right, so we're learning more and more about prostate cancer every year, but do we know what causes it?
It's continually being studied, and so it may be a genetic mutation. That's why there's some family history from one generation to the next, but we don't know quite yet. And so there's a lot of studies in terms of genetic mutations. However, we do know what puts you at risk of having prostate cancer. One, being male. Two, being older, over age 50, for example. And if you're Afro-American, have a family history of it. There's also the risk if there's a higher fat diet.
And what do you mean by that? A high-fat diet is a higher risk?
It increases your risk of having prostate cancer. And actually, truthfully, it increases a lot of risk for all sorts of different cancers.
So what is a high-fat diet?
A very simple thing to do is to look at the label of the foods that you buy. And meats will have higher fat. There are a lot of meats that have lower fat. You can look at the packaging, look at the saturated fats, look at the cholesterol, and that can guide you. So if you can keep it under 10 and 5 saturated fat, cholesterol, you're doing really well. When you're eating leaner meat, chicken breast, turkey, as well as fish.
If I'm a man over the age of 50 or 55, or I have a family member or a friend who's a male over that age and has never had a prostate cancer screening, how do you go about getting screened?
Most primary care physicians are comfortable with ordering the blood tests and also performing the additional rectal examination. And so usually you can see your primary care and they'll perform the test for you. If there's any questions, however, if the PSA is slightly elevated, if there's a question of a nodule, or if you just have additional questions, we'll be happy to see you in the urology clinic.
So is this something, as you said, primary care, your primary care provider can help you with, but if you want more peace of mind, can you schedule an appointment straight with a urologist to have this done as well?
We're happy to see anyone.
So Dr. Lee, so much has changed in the last 2 decades when it comes to prostate cancer screening. And it's amazing now what we've done with, preventing prostate cancer from occurring and then also being able to treat it early so that it's not a death sentence. This type of cancer generally is not a death sentence for men, right?
Right. So if you look at PSA, and before the era of PSA, which was back in the late 80s, when we find prostate cancer now with a PSA test, we usually find it 5 to 7 years earlier, and also is probably about 90%, over 90% cure. But if you look at the era before we had the PSA, when we detected prostate cancer by symptoms or by finding a nodule, half of those patients would have had spread already. So it's very key to find it early and increase your chances of cure.
And that PSA test generally is a pretty good guide for you to determine if prostate cancer is a possibility, right?
PSA test is very important, but it has to be complemented with a physical examination because it'll miss 15% of prostate cancers. And so you need actually both of those to be complete.
What sort of advice would you give for men out there who have not had that screening yet? What kind of advice would you give them?
There was a top 10 list of what decreases patient survival or their lifespan. And one of those in the top 10 was not seeing your physician regularly. So if you don't see your physician regularly, you're at higher risk of having a shorter life. So it's real key, whether it's seeing a physician for heart disease, diabetes, high blood pressure. Here we're talking about prostate cancer. It's real key to see a physician regularly.
And your physician should recommend, when you get to that certain age requirement, should recommend to you to have those screening tests done when appropriate, right?
Correct.
Well, unfortunately, we're all out of time, but I'd like to thank our guest today, Dr. Joe Lee, urologist from Mayo Clinic Health System, for joining us on Speaking of Health, a great topic.
My pleasure. Thank you.
Have a great day, everyone, and be healthy.